child had taken tablet prednisolone for the last 8 weeks for some renal problem. What is that renal problem for which such a long-term corticosteroid therapy is required? Nephrotic syndrome. And nephrotic syndrome in children is usually very good. Minimal change disease, right? For that, the patient might have got long-term steroid therapy, tablet prednisolone for a long span of almost 8 weeks. But now, this tablet prednisolone has been stopped since the last 1 month. Which vaccine to be avoided by the doctor? So now definitely the patient was taking which drugs? Prednisolone. And prednisolone is nothing but a corticosteroid, right? So the patient has been taking long-term corticosteroid therapy, bache. And definitely if I talk about the long-term corticosteroid therapy, you have to remember, due to that, what happens to the immunity status of the patient? Definitely it will be compromised. That means the child is definitely going to be immunocompromised. And as the child becomes immunocompromised, therefore, which vaccines are contraindicated in an immunocompromised child? Definitely all the live vaccines are contraindicated in an immunocompromised child. There are 2 types of vaccine, all of us are quite aware. One are live vaccines, दूसरे होता है killed vaccine. What do we have in live vaccine? सबसे पहले vaccine में क्या होता है? Vaccine is nothing but certain part of that particular organism. Okay, certain part of that particular organism, certain protein derivative of that particular organism, which will be given to the patient. Okay, and once that organism or once that part of that organism enters in our body, तो वो किसको stimulate करेगा जाके? It will stimulate our immune system. And in response to that, antibodies will be produced. That means in response to that, there will be an immune response. वही चाहिए होता है हमें. Vaccines are given to produce antibodies inside the body. Therefore, they are type of which immunity, bachcho? Active or passive? So definitely they are an active immunity because they are not giving antibodies. They are rather stimulating your immune system to produce antibodies. So mehnat karni pad rahi hai. Therefore, it is an example of acquired active immunity. That's the first thing. Second, vaccines दो type के होते हैं, मैंने बोला live or killed. Live vaccines में क्या होता है? Definitely a part of the organism is given, but क्या होता है? It is a live attenuated vaccine. That means उसकी जो strength होती है वो थोड़ी सी कम की जाती है. That is the only thing. कम क्यों करनी है strength? So that we can maintain the immunogenicity or antigenicity of the vaccine, but we have to decrease the pathogenicity of the vaccine. अब ये दो terms का मतलब क्या हुआ? Definitely you have to remember, अगर मैं live attenuated vaccine की बात कर रहा हूँ, if I am talking about a live attenuated vaccine, this was the question. What is done with live attenuated vaccine? Previous year question hai. We have to decrease the pathogenicity. And we have to maintain the antigenicity of the vaccine. So what do I mean by these two terms, bache? So pathogenicity means the disease causing ability. तो ये वैक्सीन या ऑर्गेनिज्म जो हम दे रहे हैं उसकी वजह से डिसीज होना चाहिए क्या पेशेंट में? तो नहीं होना चाहिए. ठीक है. सो pathogenicity should definitely decrease. That means the disease causing ability of that organism that we are giving should decrease. But what should be maintained on the other hand? Antigenicity. What is antigenicity? The ability to induce an immune response, the ability to stimulate the immune system, or the ability to get antibodies produced. तो हमें तो antibodies produce करवानी है नहीं करवानी है. So we have to stimulate what? Immune system. So that has to be done. Okay? So that is done with a live attenuated vaccine. And please remember, in an immunocompromised patient, if we give live attenuated vaccine, definitely the patient will have higher chances to develop the disease क्योंकि उसकी immunity already weak होती है. That is the reason all live vaccines are contraindicated in an immunocompromised patient. But यहाँ पे अपने patient में कितना time हो चुका है? 1 month हो चुका है. Okay, he has stopped taking the corticosteroid therapy for the last 1 month, and if there is a gap of 1 month now, definitely his immune system has recovered. उसकी immune system recover हो चुकी है. अब उसकी immune system recover हो चुकी है. That means क्या हो चुका है? उसकी immune system normal हो गई. So is he immunocompromised anymore? No. So therefore, which vaccines will be contraindicated? Anybody? None of the above. Very good. As 1 month has passed after taking the corticosteroid therapy, his immune system has recovered, you have to remember. Okay, and therefore no contraindications will be there. Agar wo bolte hai, if 1 month has not passed, if 15 days ho chuke hote bas, तो फिर कौन सी वैक्सीन कॉन्ट्राइंडिकेटेड होती? Definitely it would have been MMR, measles, mumps and rubella. The reason being it is a live attenuated vaccine. On the other hand, vitamin A is a vitamin itself, and PCV booster. PCV is actually a polysaccharide conjugated vaccine. Okay? No issues with this, anybody? So please remember, agar if it is more than 1 month after the corticosteroid therapy, more than 1 month after the corticosteroid therapy, that means no vaccine is contraindicated. You have to remember this statement. No vaccine will be contraindicated if 1 month has passed after stopping the corticosteroid therapy. No issues with this? Okay? Now let's discuss about important contraindication. Pregnancy is considered immunocompetent or an immunocompromised state. Definitely immunocompromised, and therefore which vaccines will be contraindicated again? Shabash. All the live vaccines will be contraindicated in pregnancy. Next is bacho lactation. Important is lactation mein which vaccines are absolutely contraindicated? Usually live vaccines, and the one vaccine which is absolutely contraindicated is definitely the yellow fever. Okay? One is definitely which is contraindicated is definitely the yellow fever. Can yellow fever be given in pregnancy to all patients? That's important. तुम क्या याद रखते हो कि all live vaccines are contraindicated in pregnancy except yellow fever. अगर patient, if she is not traveling to any yellow fever endemic zone, should we give yellow fever vaccine to her? Then no. Yellow fever vaccine to a pregnant female can be given, but only when she has to travel to an yellow fever endemic zone. मतलब patient pregnant है and definitely for whatsoever reason she wants to travel to Africa. ठीक है? Because it is an yellow fever endemic zone. At that time, we have to give this yellow fever vaccine. Otherwise, yellow fever vaccine देने की कोई जरूरत है क्या patient को? नहीं है. तो नहीं है. ठीक है? हर patient को नहीं दी जाती. Only if the patient wants to travel to an endemic zone. ठीक है? So exception you have to remember it is yellow fever which can be given only in certain conditions. ठीक है? And but lactation it is absolutely contraindicated. What is the reason behind that? Very good. Yellow fever vaccine which is there, it is excreted out in breast milk. And if it is excreted out in breast milk, it can go to the child, and it is a live attenuated vaccine. And therefore, it can cause infection or disease in the baby itself. Okay. So that's the reason it is contraindicated. Next, bacho, HIV positive asymptomatic adult. If it is a HIV positive asymptomatic adult, definitely his immunity, that means, is almost normal. So therefore, it is no contraindications. Next, if it is a HIV positive symptomatic adult, then which vaccines are contraindicated? Definitely all the live vaccines will be contraindicated. All the live vaccines are contraindicated. If it is a HIV positive newborn, then again, HIV positive newborn, but you have to remember this, whether the child or whether the neonate is symptomatic or asymptomatic. But as he is HIV positive, definitely chota bachcha hai, so his immunity is already compromised. Even if he develops symptoms or does not develop any symptom, that does not matter. So HIV positive newborn will always be immunocompromised, whether symptomatic or asymptomatic. Therefore, all live vaccines will be contraindicated, except which can be given. Very good. So exceptions that you have to remember, definitely the measles or MR vaccine can be given to the child. Second, definitely the oral polio vaccine can be given to the child. And the third one is definitely BCG vaccine can be given to the child as well. No issues with this. Reason is, please remember, because what is the most common opportunistic infection in HIV positive patients in India? It's TB. India, TB. Worldwide, Pneumocystis jirovecii. Very good. Okay? So in India, it is TB. That is the reason why definitely we are giving BCG. How much protection does BCG offer against pulmonary TB? Very good. No protection. 0% protection. BCG does not prevent pulmonary TB. Lung ka TB nahi rok sakta wo. So why it is given? It is only given for extra pulmonary TB. And we know in HIV positive patient, there are higher chances of extra pulmonary TB. Okay. Like abdominal TB, spine TB, etc. That is the reason we have to give BCG vaccine. It provides 50 to 80% efficacy against extra pulmonary forms of tuberculosis. No issues with this, anybody? That has to be remembered. Okay. Next important bacho is corticosteroid therapy. We have discussed already. All the live vaccines will be contraindicated, but after 1 month, no contraindication. Next, in fever, which vaccine is contraindicated, बच्चों? वैसे तो in fever, no vaccine is contraindicated except one which is not given regularly, and that is typhoid vaccine. ठीक है? So only one contraindication during fever is typhoid vaccine because it will cause fever. तो और नहीं देनी है फिर वो. Diarrhea के लिए anybody? Very good. वैसे तो diarrhea is again not a contraindication for any vaccination. The only one vaccine which has to be avoided is rotavirus vaccine because it might cause diarrhea. तो और severe हो जाएगा patient में. Next important is malnutrition. What is the contraindication for malnutrition? If the child is malnourished, that is not a contraindication. You have to remember, malnourishment or malnutrition is not a contraindication for any vaccine. हर vaccine दे सकते हो बच्चों में, ठीक है? Next is epilepsy. Epilepsy is a progressive neurological disorder. That means condition खराब होती जा रही है उसकी. Very good. Then definitely you have to contraindicate pertussis. That is nothing else but it is a part of DPT vaccine. ठीक है? So pertussis is contraindicated in progressive neurological disorders like epilepsy. But is it contraindicated in cerebral palsy? No. Cerebral palsy is not a progressive disorder. Therefore, it can be given. Okay. So here there is no contraindication as such. During epidemics, which vaccines are contraindicated, bacho? Very good. All vaccines. I'm not only saying all live. All vaccines are contraindicated during epidemics, except only one vaccine which can be given during an epidemic of that particular disease, and that is nothing but measles. Okay. Reason is, agar for example, please remember, for example, if there is an epidemic of chicken pox, okay, can we give chicken pox vaccine to the population? No. Okay. That is important. Kyunki, what is the normal incubation period of chicken pox? Anybody? Normal incubation period of chicken pox is 10 to 21 days. On an average, we can say it is 14 to 16 days. ठीक है? And what is the time that the vaccine will take to produce antibody? Vaccine कितना time लेगी antibodies बनाने में बच्चे? For all the vaccines except measles, it takes around 6 to 8 weeks. 6 से 8 हफ्ते लेती है vaccine antibody बनाने में. And this time is what is called as, this was a previous year question. Shabash. This is what is known as the seroconversion time. Okay, this is what is known as the seroconversion time. That means the time the vaccine will take to produce antibodies is known as seroconversion time. For most of the vaccines, it is 6 to 8 weeks. अगर चिकन बॉक्स का एपिडेमिक चल रहा है, आसपास बहुत चिकन बॉक्स के पेशेंट है, तुम ये बताओ तुम्हारी बॉडी में इन्फेक्शन से एंटीबॉडी पहले बनेगी या वैक्सीन से पहले बन जाएगी? Obviously, infection से पहले बन जाएगी क्योंकि infection का incubation period बस 14 to 16 days है, which is much lesser as compared to the seroconversion time, which is 6 to 8 weeks. But measles का incubation period कितना होता है? Measles का incubation period is 10 to 14 days. The normal incubation period of measles is around 10 to 14 days. And what is the seroconversion time for its vaccine? Very good. The seroconversion time for the measles vaccine is only around 7 days usually. ठीक है? It maximum is 10 days, but 7 days is the usual one. तो यहाँ पे please tell me, measles infection will produce antibodies faster or the measles vaccine? Definitely measles vaccine. So is it useful in a measles epidemic? Yes. ठीक है? So that is the only reason why measles can be given, because it has a lesser, the measles vaccine has a lesser seroconversion time as the natural incubation period of the disease. No issues with this, anybody? That's the reason. Post-disaster, which vaccines are contraindicated? Post-disaster, again, all vaccines are contraindicated, except again, which one can be given as measles? The same funda applies. ठीक है? So this is the important table that you have to be aware of. क्योंकि याद रखना, डायरेक्ट नहीं पूछेंगे. Now people will be like, sir, डायरेक्ट पूछेंगे क्या? जैसा अभी का क्वेश्चन था बच्चों, वैसे ही घुमा के पूछा जाएगा. Never expect the question to be directly HIV positive newborn. बताओ क्या है? ऐसा नहीं होता कभी. No issues with this, anybody? Next question number 2. It says a new drug does not cure a disease but decreases the risk of complications and mortality. What is mortality? Death, definitely. तो वो complications और mortality कम कर देती है patient में. What will be the change seen? So सबसे पहले you have to remember the formula. That is, there are two important things. First one is known as prevalence. What is prevalence? Shabash. Prevalence is nothing but the total number of cases. It is the total number of cases. That is new plus old cases. but the only new cases will be called as incidence. शाबाश. New cases of a disease. इस साल इतने नए cases हुए. That is what is incidence. ठीक है? तो incidence is nothing but the new cases of a disease. What is the relation between both of them? You have to remember the formula. Prevalence is equal to incidence into duration of the disease. Prevalence is equal to incidence into duration of the disease. This will make everything easier. ठीक है? Prevalence is equal to incidence into duration of the disease. Shall I see three conditions जिस पे questions बनते हैं usually? So those three conditions बचे now on which questions are commonly asked. First thing they say, a drug has been launched, a new drug has been launched in the market. Now, तीन type की drugs हो सकती है. तीन questions अलग-अलग बनते हैं इसमें से, which have been asked earlier as well. The first one says it cures the disease. So the first drug which has been launched in the market, it says it cures the disease. तो अगर वो disease को ठीक करती है तो क्या होगा? Please tell me. Now, if it cures the disease, will there be any effect on the new cases, बच्चों? It cures the disease. Does it prevent the disease? So important is cure the disease का मतलब क्या होता है? अगर patient को disease हो जाए तो उसको ठीक कर देगी. But is it preventing the disease कि disease होने ही ना दे? No. So it is curing the disease. मतलब जिसको disease है, it will cure that patient. Okay. So that you have to remember definitely. If it is curing the disease, will there be any effect on the new number of cases? No, new number of cases वैसे के वैसे रहेंगे. That means incidence will remain same. Second important है, okay? So incidence will remain same definitely. What is happening to the duration of the disease? Definitely, अगर patient जल्दी ठीक हो जाता है, okay, as it is curing the patient and the patient is getting, sorry, the patient is recovering early, definitely the duration of the disease is going to decrease. Incidence same, duration decreases. What will ultimately happen to the prevalence? Decrease. और prevalence क्यों decrease हुआ? Prevalence is nothing but new plus old cases. New cases पे कोई भी असर हुआ क्या? नहीं, new cases were the same. But what happened with the old cases? The number started decreasing. Why the number of old cases started decreasing? Because the patient started getting cured. Okay? So please remember, this is the basic funda you have to apply. If a new drug launched in the market cures a disease, you have to remember that the incidence will remain same. The incidence will remain same. Okay. Duration decreases. And thereby the prevalence also decreases. Okay? Next condition, when they say a new drug has been launched in the market which prevents the disease. Prevents मतलब disease को ठीक करेगी, disease होने ही नहीं देगी. Very good. Prevents the disease, that means it will not let the disease occur first place पे. ठीक है? That means it is which drug? It is usually prophylactic measure or therapeutic measure. Very good. Prevention is nothing but prophylaxis. Okay, prevention is nothing but prophylaxis. So if they say a new drug which has been launched in the market prevents the disease or is a prophylactic drug for that condition. Okay, तो इसका मतलब क्या होगा definitely? Now, as it is preventing the disease, so what will happen with the new cases? New cases are going to decrease because if it is preventing, नए cases आएंगे ही नहीं. Okay, and if new cases are decreasing, that means incidence is decreasing. Okay, is there any effect on duration now? No, it is not curing the patient. So there is no effect on the duration. That means the duration is going to remain same. Okay, so incidence or the number of new cases decreases. The duration remains same. So therefore, ultimately what happens with the prevalence? Prevalence is going to decrease. Old cases कैसे रहे? Same. New cases क्या हुआ है? कम. That is the reason why definitely here what is the difference which is seen? Incidence will decrease. ठीक है? Duration is same. And therefore, ultimately the prevalence is going to decrease. Remember that formula. जब तक वो formula नहीं समझोगे तब तक चीजें difficult होंगी समझना. Prevalence is equal to incidence into duration. मतलब incidence या duration दोनों में से कुछ भी गड़बड़ा जाए तो उसका असर prevalence पे दिखेगा. Okay, that has to be remembered. One of them will be same, the other one will be decreasing, so prevalence will be decreasing. Okay, one of them will be same, the other will be increasing. That means the prevalence will be increasing. Okay, so that you have to remember. No issues with this, anybody? Now, last one. The drug which has been launched in the market, it does not cure the disease, but decreases the complications and death due to that particular disease. So now here, if I apply the same formula, it does not cure the disease. So as it is not curing the disease, so what is going to happen? As it is not curing the disease, what is going to happen? Is there any change on the new cases? No. So new cases are going to remain same. That means incidence is going to remain same, barabar. Now what is going to happen with duration of the disease? Please remember. क्या कर रहा है वो? This drug, it is not letting the patients die. वो patient को मरने नहीं दे रहा. अगर वो patient मर नहीं रहा, but वो ठीक हो रहा है क्या patient? नहीं. It does not cure. That means the patient is not recovering and the patient is not dying also. So what is happening? The number of new or old cases, which one is increasing? The number of old cases is increasing. Reason is, yaad rakhna, because the patient is not having complications, the patient is not dying. Therefore, he is living for a longer duration of time. So har saal ye old cases kya hote jayenge? Carry forward hote jayenge na har baar. That is the reason. You have to remember the number of old cases will keep on increasing because the duration of the disease will keep on increasing. Why the duration of the disease occurred? Because the patient did not die and the patient did not cure also. So he's a patient or he's a case only. Therefore, the duration of the disease has increased. पहले क्या हो रहा था? एक तो patient ठीक हो रहा था या फिर patient मर रहा था. तो इसीलिए क्या हो रहा था? Number of old cases were decreasing. But अब क्या हो रहा है? ना ही patient ठीक हो रहा है, ना ही patient मर रहा है. Therefore, the duration is increasing. Therefore, that means the number of old cases is increasing. ठीक है? So that is the basic funda. So you have to remember over here, definitely the incidence remains same. The duration is going to increase and thereby the prevalence is also going to increase ultimately. ठीक है? So this was our question, बच्चों. If you haven't understood in break, definitely you can reach out to me. No issues with that. Now, please tell me, new drug launched in the market doesn't cure the disease, but decreases the risk of complications and deaths. What will be the change seen? So either we know prevalence decreases or, prevalence increases or incidence remains same. So here the answer to this question will be incidence remains same. बाकी कुछ नहीं याद रखना है. These are the things that you have to remember. That's it. ठीक है? Next important बच्चों, question number 3 now. It states a medical officer in a primary health center was explaining to the community during mass immunization program that COVID vaccine won't lead to impotency, as many people were adamant that vaccination causes impotency. Which kind of barrier in communication is described over here? Very good. This is a previous year question you have to remember. Now, definitely, for example, you are a medical officer and you want to make your public or make your public aware, or you want to educate the public in your area ki bhai, for example, खुदा ना खास्ता, the fourth wave of COVID will strike. ठीक है? And you are posted as a medical officer, so you want to educate your public. And now, when you want to convey the information, जब तुम्हें information बतानी है, तो क्या हो जाता है? बहुत ज्यादा. For example, तुमने सब लोगों को बुलाया है PSC पे, but now what has happened? All the people have come, but the problem is now there is a lot of rain. Therefore, you don't have a space to sit, and therefore you're not able to convey what you want to say. Second, for example, there is a very limited space which is there. Third, the people are living in very rural or tribal areas. They are not able to reach because there is no transport. All of these, definitely you have to remember, these are, or baby baad aa gayi, uski wajah se the people could not come. So now all of these are environmental factors due to which you are not able to communicate what you want to say. Therefore, this will be a environmental barrier in the communication. Got it? Any type of floods, any type of natural calamity, any type of problem due to the environment. ठीक है? That is important. Next important, even बहुत सारा noise हो रही है बाहर. ठीक है? That is also an environmental barrier itself. Next is physical barrier. Physical barrier, that means definitely COVID, for example. You're not able to go out because there is a risk of COVID. Therefore, all of you have got stuck in the home itself. Now, definitely, तुम्हारे पास तो Zoom है. Those people do not have Zoom. Now, definitely, that is the reason why you are not able to communicate with them. Or, definitely, as there is COVID, those people are not able to come to the PHC. Okay? So, due to these reasons, definitely, if there is any barrier like this, okay, because you are not able to meet the people and therefore you are not able to communicate them, this is what is called as a physical barrier. This will be referred to as the physical barrier. The third one is the psychological barrier. Psychological barrier matlab patient is not able to understand, or the people are not able to understand what you want to say because the patient or the person is of insane mind or unsound mind. उसका दिमाग खराब है, इसीलिए उसको समझ में नहीं आ रहा. That is what is called as a psychological barrier. Okay. And last one, or even if the person is illiterate, that will also be considered as a psychological barrier itself. But what is a cultural barrier? उसके एरिया में सब लोग यही सोचते हैं कि डेफिनेटली दैट वैक्सीनेशन लीड्स टू इम्पोर्टेंसी. ठीक है. और मीजल्स वैक्सीन इन यूएसए, यू माइट हैव हर्ड अबाउट दैट टर्म, मीजल्स वैक्सीन लीड्स टू ऑटिज्म. ठीक है, इसलिए वो वैक्सीन नहीं लगवाते थे. दैट वाज द रीजन. ठीक है. तो अगर दिस इज अ बिलीफ दैट अ लॉट ऑफ पीपल इन देयर कम्युनिटी और ऑन लॉट ऑफ पीपल इन देयर एरिया शेयर. व्हाई? बिकॉज उनकी कुछ एक्सपीरियंसेस रहे होंगे. डेफिनेटली दे हैड देयर शेयर ऑफ एक्सपीरियंसेस ड्यू टू व्हिच दे हैव डेवलप्ड दिस बिलीफ, अ स्ट्रांग ओपिनियन और अ स्ट्रांग बिलीफ. ठीक है. दैट इज द रीजन. देयरफॉर दिस इज अ कल्चरल बैरियर. दिस इज एन एग्जांपल ऑफ अ cultural barrier, because their culture, due to their culture which they share, therefore they have got this idea, or therefore they have got this strong belief or an opinion that vaccination leads to impotency. Okay, so this will be an example of a cultural barrier. This has been a previous question of FMG examination. Okay, so please remember bacho, this is an example of cultural barrier. Cultural barrier if the problem in communication is a strong belief of the public. Physical barrier if there is some problems when all of you cannot meet each other. Psychological barrier if the person is of an unsound mind or the person is illiterate. Illiteracy important is, अगर एक person illiterate है, that is what is a psychological barrier. But अगर पूरी की पूरी public ही उस area में illiterate है, that is what is a cultural barrier. ठीक है. So these are the differences that might you have to remember. ठीक है. अगर एक पर्सन illiterate है, that means बाकी सब लोग उसके एरिया में ठीक ठाक पढ़े लिखे हैं, ये स्कूल नहीं गया. So that cannot be a cultural barrier, right? That has to be a psychological one. ठीक है. So that is important. अगर mass population is illiterate, then definitely that is a cultural barrier. But if one person is illiterate, that has to be an example of psychological. Language barrier, please remember, language at times it will be a physical barrier itself, because you are not able to understand the language, or you are not able to explain the people in their own language. Therefore it will be considered as a physical barrier. Though they are in front of you, are not able to tell them what, you are not able to communicate them. So therefore even language barrier will be considered as a physical one. Environmental barrier, as I've told you, it is any environmental or natural problem which comes, that will be an example of environmental barrier. No issues with this, anybody? Language cannot be a psychological barrier. Reason is because you are not able to understand their language. It's not they who are not able to understand. You are not able to speak their language. ठीक है? You are not able to speak the language in the public. दोनों सामने हो, but you are not able to communicate because तुम्हें उनकी language बोलनी नहीं आ रही और उनको तुम्हारी language समझ में नहीं आ रही. This is not acceptable that we say कि हाँ हिंदी और English is the language that everybody should understand. No. If you are posted as a medical officer out there, that means you have to learn the language that is spoken in that particular area. Okay, so that is the reason why it will be considered as a physical barrier usually, most likely. Okay. Unsound mind mein, please remember, there is a problem with the patient. There is not a problem with, please remember, there is not a problem with you. In the second one, there is problem with you. That means you are in front, but you are not able to explain. Definitely, because you are having a problem. There is some physical problem with you that you are not able to explain them. Psychological barrier, you are able to explain the same language that they understand. They are not able to understand it. That is what is psychological barrier. Okay, they are not able to comprehend what you have told. That is the funda. Okay, language vagara is not a barrier in that. Then everything is fine. Everything is in their favor. सामने हो, आवाज नहीं है, बता पा रहे हो, but only problem is at their level they are not able to understand. ठीक है? Question number 4 बच्चों, it says a patient came with a dog bite and wound was deep and the blood was oozing out. If the wound is deep and blood is oozing out, that will be which category bite? So if I talk about categories of dog bite, category 1, category 2 and category 3. Category 1 dog bite is just a lick, for example. Lick on an intact skin will be considered as a category 1 dog bite. Second, category 2 will be Minor injuries like a scratch itself. ठीक है, minor injuries like a scratch usually will be considered as category 2. And what is category 3 then? Category 3, if there is any bleeding present, if there is any bleeding present, or if it is a deep wound, or third, if there is a bite with wild animal. Wild animal bites are to be considered as category 3. Please remember that. ठीक है? No issues with this, anybody? ठीक है. Now, normally बताओ, ये तो हम आएंगे इस क्वेश्चन पे वापस. कैटेगरी 1 में क्या करना चाहोगे? कैटेगरी 1 में ओनली कैटेगरी 1 में ओनली वुंड केयर, दैट इज वॉश द वुंड विथ रनिंग टैप वाटर एंड सोप. ठीक है, विथ सोप एंड वाटर यू हैव टू वॉश द वुंड फॉर अ स्पैन ऑफ 10 to 15 minutes यूजुअली. कैटेगरी 2 में क्या करना चाहोगे? डेफिनेटली क्लीनिंग, दैट इज वॉश द वुंड प्लस ARV. what is ARV? एंटी रेबीज वैक्सीन हैज टू बी गिवन. ठीक है. कैटेगरी 3 में क्या करना चाहोगे? वॉश द वुंड प्लस एंटी रेबीज वैक्सीन प्लस, very good, rabies immunoglobulin. All three should be given. That is the basic idea. That is very easy. अगर ये क्वेश्चन आता है पोस्ट एक्सपोजर प्रोफाइलैक्सिस, that is so simple. कैटेगरी 1 एक चीज, कैटेगरी 2 दो चीज है, कैटेगरी 3 तीनों चीज है. ठीक है. Now important is what they have said earlier. Now next one, यहाँ पे patient is having a deep wound and there is blood also oozing out, therefore it is a category 3 dog bite. It is a category 3 dog bite. Now important is previous prophylaxis which was there was given for monkey bite 6 months ago. So what is the next step in management? So now there are 3 types of prophylaxis or 3 types of preventive measures for rabies that we can be taking. Okay, vaccine 3 तरीके से दी जाती है. First is called as post exposure prophylaxis. Post exposure prophylaxis का मतलब after bite. ठीक है, the patient has been bitten by an animal and now we are giving definitely prophylaxis to the patient, that is called as a post exposure prophylaxis. Pre exposure prophylaxis मतलब अभी पेशेंट को कुत्ता नहीं काटा, फॉर एग्जांपल तुम गौतम नगर में रह रहे हो, बहुत ज्यादा कुत्ते यहाँ पे, ठीक है, एंड डेफिनेटली तुम्हें लगता है कि भाई कभी भी काट लेगा, तो बिफोर दैट ओनली यू टेक द वैक्सीनेशन. दैट इज व्हाट इज कॉल्ड एज अ प्री एक्सपोजर prophylaxis. And lastly, definitely the re-exposure prophylaxis. That means you have taken the complete course of the vaccine. CC is nothing but complete course has been taken, but now there is again a bite. Okay, now there is again a bite, so therefore that is called as a re-exposure prophylaxis. ठीक है. Now बच्चों, पोस्ट एक्सपोजर प्रोफाइलैक्सिस की अगर मैं बात करूं, यहाँ पे 2 regimes होती है यूज. फर्स्ट इज इंट्रामस्कुलर regime which is known as the SN regime. The first one, intramuscular regime, is known as the SN regime. Okay, this is a better regime, but commonly we do not use this nowadays. The second one which is there, it is a thigh updated Red Cross regime. And this Red Cross regime which is there, it is an intradermal regime. Important is the SN regime which is there, it is given as an intramuscular injection of how much ml? 0.5 ml on कितना day 0, 3, 7, 14, 28. How many doses are given? 5 doses are given. Calculate the number of letters in SN. They are 5. So that is how you can easily remember. SN regime has 5 doses. Day 0, 3, 7, 14, 28. और कितना इंजेक्शन दे रहे हो? बस एक इंजेक्शन लगा रहे हो. Therefore it can be written as 1, 1, 1, 1, 1. That is 5 times 1. Okay. Now second is the intradermal or the high updated Red Cross regime. How much dose is given over here? 0.2 ml total dose, which is divided into 2 doses. 0.2 ml is the total dose. 0.1 ml on this deltoid, 0.1 ml on the other deltoid. That means 0.2 ml is given into divided doses on bilateral deltoid. That has to be remembered. ठीक है, 0.1 ml इधर, 0.1 ml इधर. So total dose becomes 0.2 ml. ठीक है, कितने इंजेक्शन लगा रहे हो एक ही बार में? 2. ये याद रखना है. Now this will be given definitely in day 0, 3, 7 and 28. Do you give any dose at 14th day? No. So therefore यहाँ एक साथ कितने इंजेक्शन लगा रहे हो? 2. So it will become 2, 2, 2, 0, 2. This has also been mentioned in the options once. ठीक है, So that is what is the intradermal regime. No issues with this, anybody? So please remember that. ठीक है? थाई अगर याद रखोगे तो थाई definitely थाई में 4 letters है, so that is you can remember. Thai updated Red Cross regime has 4 doses in it. Next important is pre-exposure prophylaxis. Pre-exposure मतलब अभी कुत्ता काटा नहीं है, पहले ही तुम्हें देना है. So definitely, how many doses are given? 3 doses are given. Pre-exposure, pre contains 3 letters. Therefore, we give 3 doses. And at what days it is given? Day 0, 7, 21 or 28. Usually we prefer 28, but any which ways, you can even give it at 21 also. ठीक है? So 0, 7, 21 or 28. That is a pre-exposure prophylaxis. This has been a previous year question. Next important is re-exposure prophylaxis. Re में कितने अक्षर है? 2. तो how many doses? 2. But that depends कि जो पहला कोर्स लिया हुआ है, the first vaccine which has been taken, it has been taken at what time? So please remember, you have to ask the previous vaccine which was taken, or the previous vaccine or the complete course which was taken, बच्चों, was it taken prior to 3 months और मोर देन 3 months? 3 months से कम हुए हैं या 3 months से ज्यादा हो चुके हैं? अगर 3 months से कम टाइम हुआ है, then what has to be done? So then we have to do nothing, only wash the wound. No vaccine to be given to the patient क्योंकि 3 month तक तो efficacy अच्छे से रहेगी. Next, after 3 months, if it has been more than 3 months for the last vaccination or the last prophylaxis which was given to the patient, then how many doses we have to give? 2 doses we have to give, and they are given at day 0 and 3. They are given at day 0 and 3. That is re-exposure prophylaxis. Understood? That is important. ठीक है? तो pre में 3, re में 2 and post में 4 या 5. So now please tell me, this patient had a previous prophylaxis for monkey bite. How many months ago? 6 months ago. That means ये re-exposure का case है. This one, which is more than 3 months have passed definitely. तो कितने doses दोगे? 2 doses. So answer is option B, wound cleaning plus anti-rabies vaccine on day 0 and day 3 has to be given. कोई दिक्कत नहीं है इसमें? Question number 5, बच्चों. Now it says a study started in the month of February 2020, where the labor room records of patients admitted in the month of Jan 2020 with labor pain was analyzed to know the effect of oxytocin use for induction or augmentation of labor to the neonatal outcome. What type of study was used? Now, सबसे पहले तो you have to understand even before the time. जब भी study वाला question आता है, please try to check the 2 groups which are taken into study. We know that in any type of epidemiological study, it is always better to take a comparison group so that the results will not have any kind of errors. First thing. Now definitely यहाँ 2 group कौन से लिए जाते हैं वो सबसे पहले ढूंढना होता है question में. Mark it out कि ये 2 groups है study के. ठीक है? So the first group is which one? Definitely see. With labor pain was analyzed to know effect of oxytocin used for induction or augmentation of labor to the neonatal outcome. That means they are checking what effect of oxytocin use on the neonatal outcome. That means they are going from risk factor to disease or disease to risk factor. They are definitely going from risk factor to disease. They are going from risk factor to disease. ये clear है सबको? Definitely, risk factor is nothing but the use of oxytocin for induction or augmentation of labor. And what is the outcome? Definitely the neonatal outcome. बच्चे में क्या होता है उसके बाद वो देखना है. So they are going from risk factor to disease. This is a forward-looking study or a backward-looking study? Definitely, this is a forward-looking study. And as it is a forward-looking study is known as cohort. Now, cohort 2 type की होती है बच्चों. One is prospective cohort. Second is retrospective cohort. Now, prospective cohort का मतलब क्या? For example, which groups are taken into cohort study? First is exposed, non-exposed. Second is disease, healthy. Very good. In cohort study, we always have to take, you have to remember, we always have to take one group which is exposed, and the other group which is non-exposed. Exposed matlab risk factor is present. Non-exposed matlab risk factor is absent. Got it? So ऐसे 2 groups लिए जाते हैं study में, and then we have to follow these patients. We have to do a follow-up in this patient for the time we have decided, and then we will study the disease or we will study the outcome in the patient, disease effect or the outcome we have to study. So as we are going from risk factor to disease, cause to effect or exposure to outcome, therefore it is a forward looking study. That means it is a cohort study. Now as we have started the study in the year 2023 and we are going in forward direction and we are checking the results in 2033, therefore this is an example of a very good, this is an example of a prospective cohort study. Next, अभी मुझे क्या प्रॉब्लम है कि the prospective cohort which is there, मुझे दो ग्रुप्स लेने ठीक है, but after that I have to wait for a span of 10 years to know my results. As the study will be continued for a long span of 10 years, it will be very expensive. बहुत ज्यादा खर्चा लग जाएगा इसमें, बहुत ज्यादा time consuming होगा study. I will not get immediate results. So what I do to avoid this, to overcome these two things, okay, what I do is actually I go before in time. Matlab, I go in the year 2013. Okay, I go in the year 2013. I take some records of a hospital, of an NGO, or from the government. I take or I collect the records of an NGO, government, or hospital, and uske basis pe I take my exposed and non-exposed group. Uske basis pe I take my exposed and non-exposed group. That means एक group ऐसा रहा होगा who were smokers, the other group was the one who were non-smokers definitely. That means one was exposed to the risk factor of smoking, other was non-exposed to the risk factor of smoking. Now to save the time, I'm calling them today in the year 2023 and I am asking कि भाई how many of you, how many of the smokers developed lung cancer and how many of the non-smokers have developed lung cancer. ठीक है? So now definitely I'm coming from risk factor to disease. I'm coming from risk factor to disease. So it is a forward looking or a backward looking study? I'm coming from risk factor to disease. Okay, भले ही मैं time में पीछे गया, but why did I go back in time? To collect the records. And which records I collected? Exposed and non-exposed. Then I called them up and then I asked about the incidence, or then I asked about how many people have developed the disease. So this is from exposure or from risk factor to disease. This is a forward looking or backward looking study? Forward. If it is a forward looking study, then definitely it is an example of cohort study. But which cohort, bache? Retrospective cohort. This is an example of a retrospective cohort. Reason is, see, you are going back in time and then you are coming ahead in time. You are going back in time to collect the records or the data. Then you are coming ahead in time to see the number of the cases which have been developed or the number of the people who have developed the disease. Okay, so याद रखो, ऐसे याद रखना है. पहले पीछे जाके वापस अगर आगे आ रहे हो, that is what is an example of retrospective cohort study. If I talk about another condition where I say I have taken 100 patients who have developed lung cancer and 100 individuals who are healthy. And now definitely I am asking them the history. I'm asking them the history and then I want to see how many people out of them were smokers. So this is an example of backward or a forward looking study? Backward looking study. Why? Because patients have already developed the disease. Now with the help of history, I'm trying to identify the risk factor. So I'm going in a backward direction. And any backward looking study will be an example of case control study. जब दिक्कत हो बच्चों, जब दिक्कत हो कि whether it is a case control study or it is a cohort study, retrospective cohort study, क्योंकि both are similar looking. तो एक बात याद रखनी होती है, you have to see the groups which are taken into study. If the groups are the deceased individuals, that is cases, and the healthy individuals, which are controls. If those two groups are taken into study, that is an example of a case control study. Or if they mention that history is taken in the patient, that is an example of case control study. So ये तुम्हारे indicators हैं. These are your keywords that will help you diagnose a case just by looking at these keywords. Disease and healthy people taken into study, or history has been taken. Answer is case control study directly. Okay, no issues with this, anybody? But if they say that we are taking exposed and non-exposed people in the study, just to save the time, we are going back in time and collecting the previous data or records, then it is an example of a retrospective cohort study. Please answer the question now. We have started the study in the month of February 2022, but to save the time, are we starting the study today? No, rather we are collecting the records from a month ago, that is January 2020. That means we are going back in time, we are collecting the records, and then we are going from risk factor to the disease. That means from use of oxytocin till the neonatal outcome. So as we are going from risk factor to disease, that means in forward direction. This is an example of cohort. But which cohort? So this is the answer of retrospective cohort study, बच्चों. ठीक है, तो ये याद रखना, if the study has started today and exposure is taken into account, and then we have to follow up these patients till the outcome. This is an example of prospective cohort study. If the study is conducted today only, but we are going back in time to collect the records to see the exposed population, and then we are talking about the outcome today, then this is an example of retrospective cohort study. And lastly, if the study we are going back in time by taking history in the patients, that is a case of case control study. एक बात याद रखनी है, अगर क्वेश्चन में फॉलो अप या क्वेश्चन में इंसिडेंस मेंशन हो, डायरेक्टली आंसर इज कोहॉर्ट स्टडी. As soon as they mention that follow up is being done or incidence is being calculated, answer is straight away cohort. Now which cohort, that definitely you have to see, but usually they only ask cohort study. Retrospective and prospective आते हैं but less likely है, ठीक है. Otherwise only cohort and case control are the direct ones to compare. No issues बच्चों, so that has to be remembered. Question number 6 now. A child presents with normal height but weight which is lesser than expected for that height particularly. He is classified under. So now there are 3 important anthropometric indicators that you have to be aware of. Okay. First of all, if I talk about acute malnutrition, recent question है exam का, मतलब not this one, the other one. So acute malnutrition, the best anthropometric indicator to assess acute malnutrition in a child. Last एक महीने से उसको खाना नहीं मिल रहा, तो it is weight for height. Okay, the best anthropometric indicator to assess acute malnutrition is weight for height. And if the patient's weight for height is low, that is considered as weight for height. मतलब उसकी height normal होगी but उसका weight कम हो जाएगा, because it is a case of acute malnutrition. इसमें height पे कोई भी असर होगा क्या? नहीं, बस उसका weight कम हो जाएगा क्योंकि last एक महीने से उसको खाना नहीं मिला. ठीक है, so here definitely there will be low weight for height, that is known as wasting. Next is chronic malnutrition. Chronic malnutrition means from the last 6 months he is not getting enough or adequate food. That is an example of a chronic malnutrition. 6 महीने से खाना नहीं मिल रहा. So definitely his weight will be low, but what will happen to his height? His height will also be low. So if you compare बच्चे, अगर उसका weight भी low है, उसकी height भी low है, if you compare his weight to his height, what will happen? It will seem normal. बहुत बार हो सकता है कि उसकी हाइट भी कम है, तो उसके हाइट के हिसाब से अगर तुम उसका वजन देखोगे तो क्या हो सकता है, बहुत बार लगेगा कि नॉर्मल है बच्चा. बट इज द चाइल्ड नॉर्मल? नो, ही इज सफरिंग फ्रॉम chronic malnutrition. Therefore, as in chronic malnutrition, the height of the child is low, you cannot take the indicator weight for height. Then you have to take the indicator as height for age. You will compare the height for age in the child, definitely. And if there is a low height for age in a patient of chronic malnutrition, what is that called as? Stunting. And this is the 30th July exam question. Low height for age is what is known as stunting. This was a straight away question. Now, definitely I'm not saying कि हर question easy था PSM का, but some questions were easy of PSM. हाँ, तो उसी पे tackle करना होता है. पूरा का पूरा PSM कभी easy नहीं आएगा. Please guard बांध लो इस बात की. PSM पे bet करना है. Reason is, अगर कभी कभी PSM का paper easy PSM easy आ जाता है, paper 1 easy आ जाता है, तो PSM is the one who will save us. August 2020, there were 34 questions in PSM. I got 31 correct. The only reason was that PSM I had been revising for a span of almost 6 times. That's the importance of PSM. I'm not saying कि PSM 6 बार revise करो. I like this subject, so I have revised it multiple number of times. But important is PSM revise करके याद होगा. इसमें concept समझने की बहुत कम चीजें होती है usually. ठीक है? और if you are interested, then only you will understand those. ठीक है? No issues with this. The last one you have to remember, बच्चों, is acute on chronic malnutrition. If I talk about acute on chronic malnutrition, that means he is already suffering from chronic malnutrition. Last 6 महीने से उसको खाना ही नहीं मिल रहा, तो उसकी height already क्या हो चुकी है बच्चे? कम हो चुकी है. ठीक है? अब acute malnutrition हुआ है, मतलब from the last month, 1 month, he is not getting any food now. So definitely that is acute malnutrition. So definitely उसका weight भी क्या हो रहा है? कम. तो again अगर तुम weight for height देखोगे, what will happen? There will be a problem in that. Okay, एंड अगर बस हाइट फॉर एज देखोगे, दैट इज इंडिकेटर ऑफ क्रॉनिक माल न्यूट्रिशन, वो बस हाइट के बारे में बताएगा, वेट के बारे में बताएगा नहीं. सो देयरफॉर हियर द बेस्ट इंडिकेटर इज वेट फॉर एज. In acute or chronic malnutrition, the best indicator is weight for age. And if there is low weight for age, that is considered as underweight. If there is low weight for age, that is what is considered as underweight. So acute malnutrition indicator is weight for height. Low weight for height is known as wasting. Chronic malnutrition is indicator is height for age. Low height for age is known as stunting. Acute and chronic malnutrition indicator is weight for age. Low weight for age is considered as underweight. Okay. What is this instrument bachcho out here? This instrument is used to measure what? Weight of the child. So on the field, Anganwadi worker, for example, who has to assess the nutritional status of a child, okay, or growth and development of a child, उसके पास तो वो electronic weighing machine नहीं होगी. So she will use this instrument known as the shabash. It is known as the Salter scale. So which has this dial out here and the spring balance out here. Okay, that is important. Salter scale is used to measure weight. Okay, birth weight of an Indian child around कितना होता है? 2.8 to 2.9 kg. Reason is Nelson and Ghai both say different. So it is 2.8 to 2.9 kg. You have to remember. Birth weight doubles by 5 months of age. Shabash. Birth weight triples by 1 year of age. Birth weight quadruples by 2 years of age. Okay, so that is important. Next, now what is this instrument out here? This instrument is known as infantometer. An infantometer is used to measure length or height? Length. And length is measured up till what age? Up to 2 years of age. Definitely we measure length of the child. After 2 years, the child can stand. And then we can measure height of the child. Height is measured after 2 years. By which instrument? Shabash. Then it is measured with the instrument known as stadiometer. It is measured with an instrument known as stadiometer. Important is you have to remember that the height of a child or the length of the child, usually the birth length of a child is around 50 centimeters in India. The birth length usually doubles by 4 to 4.5 years of age. The birth length doubles by 4 to 4.5 years of age. And what is this instrument out here? Shakir's tape. And Shakir's tape is used to measure mid-arm circumference. It is used to measure mid-arm or mid-upper arm circumference. It is one and the same thing, definitely. What is the best instrument, or sorry, what is the best anthropometric indicator to assess the growth, the development, and the nutritional status of the child? नहीं, anthropometric indicator पूछ रहा हूँ. Best anthropometric indicator to assess the growth, the nutritional status, and the development of a child. It is weight. Weight for age. Weight. Only weight, otherwise weight for age is considered as the single best indicator to assess growth, development, or the nutritional status of a child. This has been a previous year question. Single best anthropometric parameter to assess it. No issues with this, anybody? Remember this, okay? Shakir's tape ke according, definitely children are divided into 3 zones: the green, yellow, and the red zone. Green zone means normal. Okay, yellow zone means mild to moderate malnutrition, and red zone means severe malnutrition usually. Okay, whereas severe acute malnutrition is known as SAM. There is a different diagnostic criteria for that. Question number 7. Match the vaccines with their strains. Easiest one. Sabse pehla, dengue vaccine. Right, the strain for dengue vaccine, which is a dengue vaccine, it is CYD-TDV, which contains all the 4 dengue strains, that is D1, D2, D3, and D4. Previous year question, bacho, that this dengue vaccine or the dengue vaccine has been developed. This strain has been developed based on which previous vaccine strain? पहला कौन सा वैक्सीन स्ट्रेन था जिसका स्ट्रेन हटा के इसका स्ट्रेन डाला गया? येलो फीवर. येलो फीवर वैक्सीन का जो 17D स्ट्रेन था उसी पे बेस्ड डेफिनेटली वी हैव प्रिपेयर्ड द न्यू स्ट्रेन CYD-TDV of a vaccine of dengue vaccine. ठीक है, so the previous strain which was used for preparing dengue vaccine was the 17D strain of yellow fever vaccine as a previous year question. नीट पीजी का है, दैट्स इंपॉर्टेंट. नेक्स्ट इंपॉर्टेंट इफ आई टॉक अबाउट, एंड हाँ नीट पीजी के क्वेश्चंस करने, द रीजन इज नीट पीजी एंड एफएमजी आर कंडक्टेड बाय द सेम बोर्ड ऑफ एग्जामिनेशंस, देयरफॉर द क्वेश्चन कमिंग इन बोथ द एग्जामिनेशंस विल बी वेरी वेरी सिमिलर, okay, rather same at times. Next is rabies vaccine. Rabies vaccine का vaccine strain क्या होता है? It is the fixed viral strain definitely. Next mumps vaccine का क्या होता है? Mumps is gerrylrine. And lastly yellow fever का क्या होता है? It is 17D. What is the answer? It is 1 का D, 2 का, sorry, 1 का C, 2 का D, 3 का B and 4 का R. हाँ हाँ, 1 का C, 2 का D, 3 का A and 4 का B. No issues with this anybody? So let's talk about the vaccine strain. जल्दी से बताओ. BCG का vaccine strain. BCG का vaccine strain is Danish 1331. OPV का vaccine strain. OPV is the oral polio vaccine. उसका vaccine strain. Oral polio vaccine is live or killed? Live. And live strain of polio vaccine is Sabin. Whereas IPV is inactivated polio vaccine. So inactivated का मतलब है killed. Definitely here it is Sal. K for killed. That is how you remember. या फिर बच्चों, you have to remember the OPV which is used nowadays is a bivalent OPV. So the strains which are used are P1 and P3 because P2 has been eradicated from the world. That's the reason. ठीक है, तो हमेशा Sabin होगा ऑप्शन में, जरूरी नहीं है. It can be P1 and P3 also which can be written. Next is measles. Okay, for measles it is Admonstron Zagreb strain. For mumps it is Gerald Lynn strain. For rubella it is RA27/3 strain. Then next for yellow fever it is 17D strain. Next for anti-HIV vaccine. Very good. Bolo. MVA Ankara. For anti-HIV vaccine it is MVA Ankara. Ankara याद रखना है. Next for dengue vaccine we have discussed CYD TDV. For Mosquirix, which is the first and the only licensed anti-malarial vaccine, it is RTS-S. Japanese encephalitis live. It is the part of our national immunization schedule. We use the live wala vaccine. We don't use the killed wala vaccine. And it is which one, bacho? SA 14-14-2. Japanese encephalitis killed, which is not used in India. It is Nakayama, or the second one being Beijing P3. It is Nakayama or Beijing P3, which are the vaccine strains of Japanese encephalitis killed vaccine. Next is varicella. Jack Van भी इसी में आता है, but the common ones which are used in killed Japanese encephalitis vaccine is Nakayama and Beijing P3, which is not used in India, but in other Mongoloid countries like China and Japan. Killed only. ठीक है? No issues with this. Varicella. What is the vaccine strain for varicella? Oka strain. तो यहाँ पे चौका याद रखना है. Varicella is nothing but chicken pox. तो ऐसे याद रख लो चौका. That is chicken pox. It is Oka vaccine strain. And rabies, it is the fixed viral strain. It is the fixed viral strain for rabies vaccine. No issues with this, anybody? These are the important vaccine strains that you have to remember. I'll share the PDF. Don't worry about that. Next is acute encephalitis syndrome cases were reported from Gorakhpur, Uttar Pradesh. The health authorities decided for mass vaccine. PDF share करूंगा मतलब अपने notes निकालना बंद करो, ये नहीं बोला मैंने. याद रखना अपने notes. Okay, you have to make your own notes for TNDs, especially the TND wala people. You have to make it. If there are any points extra in your notes which are to be added at the end of your notes, or make a paper जहां पे सब add करोगे. क्यों? जब notes revise कर रहे हो ये extra points भी revise हो जाएंगे. अलग से PDF खोलने की जरूरत नहीं पड़ेगी. That's the reason. Acute encephalitis syndrome cases were reported from Gorakhpur, Uttar Pradesh. The health authorities decided for mass vaccination under the Universal Immunization Program. Identify the vaccine type and route. पहले कौन से disease या कौन से vaccine की बात हो रही है? They are definitely talking about Japanese encephalitis, and we know definitely बच्चों that Japanese encephalitis which is there, it is endemic to the states of Bihar, West Bengal, and even eastern parts of Uttar Pradesh, like the Gorakhpur district. Okay, rather it is endemic, always present in these districts. Okay, so as they are talking about encephalitis syndrome, rather most common cause of encephalitis in India is Japanese encephalitis. Most common cause of encephalitis worldwide, it is herpes simplex virus type 1. ठीक है, that's the basic one. So अगर इंडिया में encephalitis की बात हो रही है, by default they are more likely talking about Japanese encephalitis, and definitely they are talking कि to prevent the spread of Japanese encephalitis, definitely we have to give mass vaccination to the people. So what is the vaccine type of Japanese encephalitis used in India? It is definitely a live attenuated one which we use in India. Therefore, ये killed वाले तो options are ruled out. ठीक है? It is a live attenuated strain, that is SA14-14-2, which we use in India. So please tell me definitely that this route of vaccine administration of Japanese encephalitis is intramuscular, subcutaneous. It is live attenuated vaccine given by the subcutaneous route. But you have to remember that there are only two vaccines which are given. Two vaccines given by intradermal and two vaccines given by the subcutaneous route. Rest all vaccines are given by the intramuscular route itself. So which vaccine is given by intradermal route? BCG. BCG vaccine which is there. Okay, it is 0.1 ml which is given, the dose, and the route of vaccine administration is definitely intradermal. कहाँ पे देते हो? लेफ्ट डेल्टॉइड, जो निशान पड़ा हुआ है अभी भी लेफ्ट डेल्टॉइड पे, इट इज द बीसीजी वैक्सीन व्हिच हैज बीन गिवन. ठीक है, नहीं है तो जाके भाई लगवा लो. ठीक है, तो 0.1 ml इंट्राडर्मल रूट लेफ्ट डेल्टॉइड पे इट इज गिवन. ओपीवी, ओरल पोलियो वैक्सीन, ऑब्वियसली द रूट इज ओरल इटसेल्फ. डीपीटी वैक्सीन बचे, डीपीटी it is a intramuscular, so dose is around 0.5 ml. It is an intramuscular vaccine which is given. Hepatitis B, again the dose is 0.5 ml. The route is intramuscular, and both are given on the anterolateral or the anteromedial thigh. Reason is, why in neonates we do not give it on the buttocks? Because the muscle mass on the thigh is more as compared to the buttocks of a neonate or an infant. That is the reason why we prefer the side as thigh, because better absorption is going to take place from the thigh region. Okay? That is important. Next is measles and Japanese encephalitis. Measles and Japanese encephalitis, dose is 0.5 ml only again, but the route for both of them is same, that is subcutaneous. The route for both of them is subcutaneous, and the site is usually the same, that is right arm. So right arm pe subcutaneous vaccine is given. Measles and Japanese encephalitis. The only two vaccines which are given by the subcutaneous route in Indian program, that is measles as well as Japanese encephalitis. Okay, the two vaccines which are given by the intradermal route, first is BCG and second is DPT. तो intramuscular है ना. IPV. IPV is also given by the intradermal route itself. So two vaccines by intradermal and definitely two vaccines by subcutaneous route. कोई दिक्कत नहीं है. बाकी rest all by either oral or intramuscular route. Mostly intramuscular. ठीक है. Vitamin A तो solution it is given by oral route. ठीक है. Question number 9 बच्चों. Now this talks about the prevention of a disease. The image shown below depicts which level of prevention. What is this image showing us? These patients are definitely having swelling of the limb, and usually the swelling of limb is suggestive of elephantiasis, and elephantiasis is a complication associated with which disease? It is which filariasis? Please remember, patients have developed a complication, that is swelling of limb, due to a condition known as elephantiasis, and elephantiasis is a complication associated caused by Wustericea bancrofti. Important is you have to remember, disease has already occurred in the patient. ठीक है, तो disease already है, तो आप disease को prevent कर सकते हो क्या तुम? नहीं. Okay, so उसके अलावा disease है, but उसके साथ साथ क्या हो चुका है disease का? Complication भी है, because elephantiasis is not a symptom, it is rather a complication of lymphatic filariasis. तो complication भी है, मतलब disease तो हो ही चुका है, कॉम्प्लिकेशन भी हो चुका है. तो ट्रीटमेंट का कोई मतलब बनता है क्या अभी? नो. तो ट्रीटमेंट नहीं करोगे तो क्या करोगे? अभी जो हो चुका है उसका ख्याल रखोगे. दैट मीन्स डेफिनेटली you will apply which level of prevention? If I talk about levels of prevention, there are 4 levels of prevention: primordial, primary, secondary, and tertiary. Primordial level of prevention is before the risk factors or after the risk factor? It is applied before the risk factor. For example, अभी मच्छर है ही नहीं, उसके बावजूद you are educating the public in the surrounding कि भाई मच्छर जमा कैसे नहीं होने देने. That is what is definitely comes under primordial level of prevention. That means even before the risk factors appear, we will educate the public. So primordial prevention is done by health education, by making public aware of it. Second is primary prevention. Primary prevention is after the risk factor. So when the risk factor is present, then definitely the preventive measures that we will take, they will come under primary level of prevention. For example, अभी बारिश हो चुकी, पानी जमा हो चुका, जिसकी वजह से मच्छर डेवलप हो चुके. Now मच्छर or mosquitoes are definitely a risk factor for all the vector-borne diseases. So they are already present, bachcho. Now if they are definitely present, then what should be done? Either we can do health promotion. What do I mean by health promotion? That means we will educate our public or we will make them aware कि भाई अगर किसी को भी बुखार आ जाता है, whenever you will have any symptoms regarding this particular disease, immediately seek medical help. Okay, that is promoting health in the public. तुम क्या बोल रहे हो कि डेफिनेटली ये चीजें यूज करो जिसकी वजह से मलेरिया नहीं होगा, ओडोमॉस यूज करो, बाकी चीजें यूज करो. ठीक है, यू आर प्रमोटिंग द यूज और यू आर आस्किंग देम टू सीक मेडिकल हेल्प एज सून एज दे डेवलप सिम्टम्स. सो दिस इज एन एग्जांपल ऑफ हेल्थ प्रमोशन and therefore it comes under primary level of prevention. Second is people are using mosquito nets, they are using mosquito repellents, okay, or you are spraying malathion, DDT spray in the surrounding to kill those mosquitoes. This is an example of primary level of prevention because you have to kill the mosquitoes. But which one? Specific protection. Q, mosquito nets, mosquito repellents, insecticides. Why are you using them? To kill the mosquitoes particularly, so that they will not spread the vector-borne diseases. So this is specific protection against a particular vector-borne disease. Okay? So primary level of prevention can be two types. One is health promotion, second is specific protection. Health promotion comes by public awareness, okay, and usually specific protection is when the public are going to use some method which will protect them against that particular disease. Okay? Next is secondary level of prevention. Secondary level of prevention matlab the disease has already started. अगर already disease start हुआ है, भले ही patient में symptoms है या नहीं है, that is secondary to it. ठीक है? Disease has already started. So now, can we prevent the disease? No. So what we have to do? We have to do the diagnosis of the disease as early as possible. So we have to do early diagnosis of the disease. And to do early diagnosis of the disease, if the patient doesn't have symptoms, then we will use a screening test. And if a patient has the symptoms, then we are using a diagnostic test. Right? Screening test is applied on a healthy population. जिनको symptoms नहीं है, उनमें जल्दी से disease पता लगे. Diagnostic test is applied on a population who has symptoms. ठीक है? And second will be treatment. अगर treatment दे रहे हो किसी भी type की, that comes under secondary level of prevention. Tertiary मतलब the disease is already over or there are complications in the disease. There are complications in the disease which are occurring now. So here, what you have to do? You have to limit the disability of the patient. So you have to go for disability limitation. And second, you have to go for rehabilitation. ठीक है? For example, polio हो चुका patient को, अब polio हो चुका है, and now due to polio he is having paralysis and therefore he is using crutches, okay, to walk. Okay, as he's using crutches to walk, they are an example of tertiary level of prevention. Q, because these crutches की वजह से the patient can walk. That means they are limiting his disability. कम से कम चल तो पा रहा है. Therefore, they are used for disability limitation. Second, as the patient can walk, he is getting work. He is getting employment. Therefore, we are doing his rehabilitation. So crutches and polio are an example of tertiary level of prevention, both disability limitation as well as rehabilitation. Please tell me jaldi se, all vaccines are examples of primary level of prevention. Which one? Health promotion or specific protection? Specific protection, because measles vaccine will protect you against only measles disease. Therefore, they are an example of specific protection. Except BCG vaccine in bladder cancer. It is an example of secondary level of prevention because BCG vaccine in bladder cancer is used for treatment. Next, all contraceptives are an example of primary level of prevention. Which one? Health promotion or specific protection? Specific protection. Reason is because contraceptives are protecting you against pregnancy. Therefore, they are an example of primary level specific protection. Except, sorry, COCPs, combined oral contraceptive pills in endometriosis or PCOD. They are example of secondary level of prevention because they are used there for treatment. Okay? Next important. Sorry, asking the public, जो केजरीवाल की गाड़ी घूमती है यहाँ पे, asking the public to not let rainwater accumulate. That is an example of primordial level of prevention because we are educating the public even before the risk factor appears. Then definitely, sorry, using the pamphlets to educate the public, to tell them कि if you develop symptoms of malaria, you have to seek medical help. That is an example of primary level of prevention. But which one? Health promotion, because we are promoting health in the public by educating them around it, due to it. Next, peripheral blood smears and rapid diagnostic test of malaria. Secondary, because they are used for diagnosis. Next, artemisinin based combination therapy of malaria. Secondary, because ACT is used for treatment of malaria. Okay, so that is important. Complications are not seen commonly with malaria usually. Okay, that is important. Next important is your spectacles or contact lenses. Tertiary level of prevention, because are they correcting the refractive error? No, they do not. They only limit your disability. That means you are able to see, and due to that you can work. That is rehabilitation. That tertiary level of prevention. Intraocular lenses. Intraocular lenses are an example of secondary level of prevention because intraocular lenses are used in cases of cataract surgery. That means for treatment. Therefore, they're an example of secondary level of prevention. Got it? So that's important. Okay? Chalo. So coming back, as the patient has already developed complication, definitely we have to apply tertiary level of prevention. And tertiary level of prevention is either disability limitation or rehabilitation. So here we are doing disability limitation. Why? क्योंकि हम क्या करवा रहे हैं पेशेंट्स को? We are asking them to do the wound cleaning so that the infection, any other infection does not spread, because they are at high risk of developing other infection. So we will ask the patient to maintain wound hygiene or maintain wound to do wound cleaning so that they will not develop any other infections or any other complications further. Okay? So this is an example of tertiary level of prevention, disability limitation. Question number 10, it says a particular contraceptive X is used by 100 couples in the community for a period of 2 years now. During this period, 20 women become pregnant despite the use of contraceptive X. What is the pulse index of contraceptive X? Now, definitely, bacho, that pulse index which is there, it is used to assess what? It is used to assess contraceptive failure. Please tell me which is the best indicator of contraceptive failure. The better indicator of contraceptive failure is life table analysis followed by pulse index. So yaad rakhna, it is not the best. Life table analysis is a better indicator of contraceptive failure. What is the formula of pulse index, bache? Very good. It is the number of accidental pregnancies upon the total months of exposure, and the multiplier is shabash. That has to be remembered because a lot of people multiplied by 100 otherwise. The multiplier is 1200. Abhi yahan pe kitne total couples use kar rahe the? 100 couples. Out of them, how many got pregnant? 20 accidentally got pregnant. So what will be the number of accidental pregnancies? 20 upon 100. And total months of exposure, कितने टाइम के लिए यूज किया उन्होंने? For a span of 2 years. अगर 2 साल के लिए यूज किया, मतलब the total months of exposure is 24 months because I'm taking it in months. Okay, into multiplier is 1200. कितना हो जाता है? It is 24,000 upon 2400. So definitely you can see it is 10. So it is 10 per 100 women years. The unit to express Pearl index is per 100 women years. No issues with this, anybody? That is important. जल्दी से बता दो. Male condoms. What is the Pearl index? Percent nahi, per 100 women years. So for male condoms, it is 2 to 14 per 100 women years. Single best answer will be 14. हमेशा ऊपर की वैल्यू बताना है यहाँ पे. Next is female condoms. It is 5 to 21 per 100 women years. Vaginal sponge. Vaginal sponge, it is 9 to 20 per 100 women years. ये जो तुम्हारा 2 day आता है ना, that is your vaginal sponge. ठीक है. Next, lastly important किसका है और सहेली तुम्हारा, that is Centroman tablets. Centroman tablets. It is 1.84 to 2.84 per 100 women years. ठीक है. What is the failure rate or what is the Pearl index of IUDs, intrauterine contraceptive devices? It is 1 to 5 per 100 women years. On an average अगर आंसर करना हो, 2 is the best answer. On an average, 2 is the best answer for IUDs. ठीक है, क्योंकि प्रीवियस ईयर क्वेश्चन जो आया था उसमें 2 ऑप्शन में था, बाकी कुछ ऑप्शन में नहीं था. Okay, so most likely they are saying 2 will be the best one. Then which has the least failure rate or least Pearl index? Sterilization. What is the Pearl index for sterilization? Very good. It is so low as 0.1 per 100 women years, even less than that, 0.1 and less. No issues with this. These are the important Pearl index to be remembered. Question number 11. In assessing the association between maternal nutritional status and the birth weight of the newborn, 2 investigators, A and B, studied separately and found significant result with a odds ratio of 0.8 and 1.2 respectively. From this information, what can you infer about the study? First of all, as they have calculated the results in terms of odds ratio, it is an example of which study? Very good. Definitely, as the strength of association in this patient or in this study is calculated by odds ratio, therefore it is an example of a case control study. Whereas strength of association in a cohort is calculated by, in cohort, the strength of association is calculated by the relative risk, which is incidence and exposed upon incidence in non-exposed. Whereas even attributable risk or population attributable risk, they will also be calculated in cohort study, क्योंकि सबके formula में क्या आता है? Incidence, and incidence is only calculated in cohort study. So relative risk, attributable risk, and population attributable risk all are taken into cohort study only. But odds ratio is taken into case control study, which is also known as the cross product ratio, AD upon BC. How to analyze this strength of association? If relative risk or odds ratio, if both of them are more than 1, that is suggestive of positive association. What do I mean by this? Risk factor leads to the disease. Okay. Next one, if the strength of association is equal to 1, there is no association between the risk factor and disease. मतलब भले risk factor present हो, absent हो, that does not cause any change in the number of cases of that particular disease. And if the if the strength of association is less than 1, that is suggestive of negative association. That means it is protective. That means if you have the risk factor, that is rather protective for that particular disease. No issues with this, anybody? That is important. Like smoking, usually sometimes some books and some studies say it is protective against breast cancer, okay, in certain age group. That is important. Okay. Now see, if the odds ratio, if I talk about this over here, investigator A का odds ratio कितना था? 0.8 और investigator B का कितना था? 1.2. So definitely investigator A का odds ratio was less than 1. That means it was suggestive of negative association or protective. But investigator B odds ratio was more than 1. That means it was suggestive of positive association. Option A says the strength of association of investigator B is suggestive that cause can lead to the effect. Is it so? No. Strength of association of investigator A was 0.8. That means it was less than 1. It is rather telling that risk factor cannot cause the disease, or the cause cannot lead to effect. Rather, it is protective for the effect or protective for the disease. Therefore, this is a wrong statement. Option B says strength of association of investigator B suggests that effect is associated with the cause. Is it true? Yes, because strength of association of investigator B is 1.2. It is more than 1. That means it is having positive association. Matlab, it states that cause can lead to the effect. Okay? Estimates of association obtained by A and B will be equal since both are significant? No. Nothing can be concluded as information is inadequate? No. Question number 12. A patient comes with a small clean wound on the knee, which is 10 by 2 centimeter, 12 hours ago. He had taken the TT vaccination 10 years back for another injury. What should be done in this patient now? So, बच्चों, if I talk about this, ठीक है? So you have to assess a wound. बस important चीजें याद रखो यहाँ पे. First of all, we have to classify the wound as a clean or a minor wound and any other type of wounds. Okay, all other type of wounds, which is contaminated, any puncture wound, any avulsions, any degloving injury. Okay, all of these. Important is if it is a clean or a minor wound, first of all, you have to ask the patient whether he has taken the TT or the TD vaccine or not. Okay, whether he has taken the TT or the TD vaccine or not. If the patient has not taken the TT or the TD vaccine or the status is unknown, ठीक है, तो हमें क्या करना पड़ेगा? We have to administer the vaccine today. Single dose या complete course? Definitely we have to administer the complete course of the vaccine today. ठीक है? But बच्चों, if the patient has taken the vaccine, then you have to ask the patient whether the patient has taken the vaccination 5 or 10 years ago usually. ठीक है? If the patient has taken the vaccination 10 years ago, if the patient has not taken the vaccine 10 years ago, that means usually कितना time हो चुका है? Definitely, it's been more than 10 years. Agar if it is more than 10 years, definitely we have to administer the vaccine. Single dose या complete course? Definitely we have to give complete course if it is more than 10 years. But if it has been less than 10 years, बच्चों, if it has been less than 10 years, then we have to again see if it is 5 to 10 years हो चुके हैं या definitely more than 10 years हो चुके हैं. More than 10 years का तो बता दिया definitely. Or if it is less than 5 years which has happened. अगर less than 5 years है तो कुछ चाहिए क्या? No vaccine is required. And if it is 5 to 10 years, then कितना dose चाहिए बस? 1 booster dose is required. ठीक है, 1 booster dose is required. ठीक है, no issues with this anybody? Next is definitely if there are any other type of wounds, so you have to again check whether the patient has taken the TT or the TD vaccine. If the patient has not taken or the status is unknown, you have to administer the vaccine, that is the complete course of vaccination to be given along with tetanus immunoglobulin, But if the patient has taken the TT or the TD vaccine, then you have to see whether the patient has taken in the last 5 years or not. If the patient has not, it has been more than 5 years now, then you have to give the vaccine. Definitely you have to administer the vaccine. But agar 5 साल से कम हो चुके हैं, then definitely you need 1 booster dose of the vaccine because it is a contaminated wound. No issues with this anybody? So that's the basic funda you have to remember. See, this is a chart definitely which is shared by a lot of countries, and that is the reason there will be some minute changes. ये India का जो chart है, that have changed. Years or more than 10. Okay, hopefully I'm audible now. Okay. So if you have to ask the patient whether he has taken the TT or the TD vaccine or not, if he has not taken the TT vaccine or the status is unknown, then definitely you have to give the complete course of vaccine. But along with that, you also have to give immunoglobulins. Reason is now it is a contaminated or a deeper wound. That is the reason. Next, if the patient has taken the vaccine, then you have to ask whether the last vaccine was within 5 years or more than 5 years. If the last vaccine was within 5 years, then you have to give one booster dose. But if the vaccine was more than 5 years, then you have to give the complete course of vaccination. कोई दिक्कत नहीं है इसमें. Now coming back to our question, our patient is definitely having a small clean wound and he has taken the last vaccination kab 10 years back. So he is having a clean wound. He has taken the vaccination, yes, but when? More than 10 years back. So we have to give complete course of vaccination. Okay, so full course of tetanus toxoid. Do we need immunoglobulins? No. As it is a small and a clean wound, we do not require any kind of immunoglobulins. So answer for this one would be option C. A village had an outbreak of meningitis with the below given rash. Which kind of rash is seen, bacho? Can you see there are bleeding spots which are seen on the lower limb? These bleeding spots, medium ones, are known as purpura. So this is a type of a purpuric rash. Patient has developed meningitis with a purpuric rash. Which among the following is the best drug to be used for mass chemoprophylaxis of large population in this village? What is your provisional diagnosis? Provisional diagnosis, कौन सा meningitis है? Very good. It is a case of meningococcal meningitis. It is an example of meningococcal meningitis. Meningitis ka triad sometimes they can mention in the question. The patient will have headache, the patient will have fever, and the patient is going to have neck stiffness or nuchal rigidity. Okay, sometimes even vomiting, but these are the special three things in a triad. And along with purpuric rash, if they mention, then definitely we will think in terms of meningococcal meningitis caused by meningococcus, also known as Neisseria meningitidis. Which strains are known to cause serogroup? A, B, C, W135 and Y. These are the strains. But which one is not present? A is the most common. In vaccine, which one is not present in the meningococcal vaccine? Yes. B will be not present in the meningococcal vaccine or the meningococcal conjugate vaccine. Okay? You have to remember that these serogroups A, B, C, W135 and Y are responsible to cause meningococcal meningitis, A being the most common. But जब हम vaccine prepare करते हैं meningococcal conjugate vaccine, this has been a previous year question, which serogroup is not a part of the meningococcal conjugate vaccine? You have to remember serogroup B is not a part of the meningococcal conjugate vaccine. Okay? Chalo. So now definitely we are talking about mass chemoprophylaxis of meningococcal meningitis. But the three drugs which are used in cases of prophylaxis or prevention of meningococcal meningitis are: first is ceftriaxone, second is rifampicin, third is ciprofloxacin. So what is penicillin G used for? Penicillin G is used for definitive treatment. That means once you get to know it is a case of meningococcal meningitis, then the drug to be used is penicillin G. Ceftriaxone can also be used for treatment, but that is used for empirical treatment. What do I mean by this? The patient has come to the emergency with complaints of meningitis. We still are not sure that it is due to meningococcus only. We are not sure. Therefore, we want to give broad spectrum antibiotic. And that broad spectrum antibiotic which can be given is ceftriaxone. Okay? So here we are not sure about the exact cause, but we give the treatment. That is called as an empirical treatment. Okay? You have to remember the best prophylaxis is also done by ceftriaxone itself. The best prophylactic drug is also ceftriaxone. But the problem is that ceftriaxone is a injectable drug. पूरे गांव को देना है, तो पूरे गांव को इंजेक्शन ठोकोगे क्या? No. So definitely it is not possible in a mass chemoprophylaxis that you will give an injectable drug. Therefore, you have to give an oral drug to these patients. Previously, it was rifampicin, but now it is ciprofloxacin, which is considered a better drug, which is a fluoroquinolone. But we know fluoroquinolones like ciprofloxacins are definitely contraindicated in pregnancy and children. In pregnancy and children, therefore, for chemoprophylaxis, we have to use another drug. we have to give what? Ceftriaxone. Because pregnancy and children will be a smaller group now. In that, definitely we can give an injectable drug. Therefore, we'll give a safer drug like ceftriaxone. No issues with this. So mass chemoprophylaxis of meningococcal meningitis, the drug of choice you have to remember is ciprofloxacin, which is an oral drug. But for pregnancy and children, it is contraindicated. Therefore, in them, it is ceftriaxone. Definitive treatment, it is penicillin G, and empirical treatment, it is ceftriaxone again. Overall, best prophylactic measure is ceftriaxone. कोई दिक्कत नहीं है इसमें? Question number 14. In rural areas, the patients don't have insurance, but under the ESI Act, the local registered medical practitioner can render which of the following service to the beneficiary who are covered under the ESI scheme? Now, first of all, what is ESI scheme, ESI Act, or ESIC? For that matter, you have to remember this logo. This logo stands for ESIC. ESIC is nothing but Employee State Insurance Corporation. Now, definitely, this Employee State Insurance Corporation is an authority, or it is a body which has been established after the ESIC Act of 1948. You have to remember that after that ESIC Act of 1948, Employee State Insurance Corporation came into existence. And it came into existence under the Ministry of... It came into existence under the Union Ministry of Labor usually. Okay? And then definitely, kya purpose tha? That all the people who are working as laborers, or all the people who are working at lower wages or lower salaries, they will be given medical insurance under this scheme definitely. Okay? All people who are covered are less than, people having salary of less than. So a salary of 21,000 per month or lesser. Okay? So people who are covered under the SIC scheme are the people who are having a salary of less than 21,000 per month are covered under the scheme. Unko kya karna hota hai? Every month they have to give some amount of salary, okay, to the ESIC, that is your Employee State Insurance Corporation. But not only the person who is working, but rather his owner also. For example, a person who is working in a factory, so that person will definitely give some amount of his salary, but more amount will be given by the factory owner himself. That means if I talk about the contribution which is given, employee का contribution क्या होता है? Employee जो है काम करने वाला, उसका contribution होता है 0.75%. But what is the employer contribution? Employer मतलब जो काम करवा रहा है, the factory owner, his contribution is 3.25% wages. Basic condition being, this factory should be registered under the ESIC scheme. Then the owner has to give 3.25% and the employee has to give 0.75% of the wages or 0.75% of total salary. So 4% of the person's salary every month is given to the ESIC. And under that, definitely the ESIC will give the medical insurance to the patient. That means the patient, not only the patient, but rather the person and his family which is registered. The person and his whole family which is registered will get free medical service. Not only primary, but primary, secondary and tertiary medical services they will get at these hospitals. Therefore, these primary, secondary or tertiary medical services, yes, okay, almost everything, matlab, from just a treatment to definitely CT scans, MRI, chemotherapy, surgeries, everything they will get under this. Okay? The largest center of ESIC, the ESI hospital is ESIC Basai Darapur in Delhi itself. Important is, you have to remember that ये direct दो type का benefit होता है. एक होता है direct benefit and second is indirect benefit under the scheme. Direct benefit matlab the patient is getting the medical services from the ESI hospitals. You might be aware that in every state there are some ESI hospitals. So if the patient and his family goes to that ESI hospital and avails the medical service, that is an example of a direct medical benefit. But अगर for example मेरे इलाके में ESI hospital ही नहीं है, तो मुझे नहीं मिलेगी क्या medical service? I will get the medical service, but by the empaneled hospitals. Empaneled hospitals matlab the registered hospitals under the ESIC scheme. These are private hospitals, but they are covered under the ESIC scheme. So that patient goes to that hospital definitely and his expenses will be covered or his expenses will be paid by the ESIC. ठीक है. So if I take it from the empaneled hospitals or any private practitioner, then it is an example of a indirect medical benefit. ठीक है. Here they are saying that his area do not have any ESI hospital. Therefore, he is getting the medical benefit from registered medical practitioner. So this is an example of indirect medical benefit. This has been a previous year question of your examination. Sickness benefit which is given under ESIC is how many days? Sickness benefit. It is for a span of 91 days. On how many percent wages? शाबाश. On 70% of his salary. मतलब उसको 91 days की छुट्टी मिल सकती है if he is not feeling well. Okay, and he will get 70% of his salary for those months. Second, extended sickness benefit he gets for a span of 2 years. For example, if he has been diagnosed with TB, so he will get off of 2 years, for example. But on how many percent wages? On 80% of his wages. ठीक है. Then there is also enhanced sickness benefit. Enhanced sickness benefit, that means if the patient undergoes sterilization. Enhanced sickness benefit क्या होता है? If the patient opts for sterilization, either vasectomy or tubectomy, then definitely they are going to get off. On how many percent wages? 100% wages they will get an off. Males will get an off for 7 days and females will 14 days. Discrimination. ठीक है. No issues with this, anybody? And maternity benefit under the Factory Act, under the ESIC Act is same. It is for a span of maternity benefit. Recent question again. Maternity benefit is for a span of 26 weeks or 6 months. On how many percent wages? So maternity benefit is for a span of 26 weeks on 100% wages. ठीक है. That usually you can take from the 8th month of your pregnancy. Okay, after that. Question number 15. In a village, young men with history of successive crop failure develops progressive spastic paraparesis. Okay, paresis is nothing but paralysis of the limbs, definitely. Okay, there are upper motor neuron signs which are elicited. Upper motor neuron signs, matlab there will be spastic paralysis. The tone of the muscles will be increased. There will be exaggerated or brisk reflexes, and the Babinski sign is going to be positive. जब medicine पढ़ोगे तो आसानी से याद रहेगा. There will be gait instability in the patient as well. The patient could not walk properly. Therefore, he has to use a stick always. ठीक है, तो 1 stick, 2 stick stage पढ़ा होगा. And most likely toxin responsible for this condition is. What is your provisional diagnosis, बच्चे? So definitely here, it is a case of a adulteration disorder. Please remember, क्योंकि not only a single person in that village, but many young men in that village have developed the same disease. Okay, as there has been successive crop failures, तो क्या हो जाता है? अगर crop failure हो जाता है तो normal खाना नहीं मिल पाता. So definitely to earn more, people try to adulterate. ठीक है, and therefore these people might have adulterated kesri dal, which is an adulterant, which is cheaper. They might have adulterated it in another अरहर या तुअर दाल. जो तुअर दाल मिलती है तुम्हारी, उसमें केसरी दाल मिक्स कर देते हैं to achieve more benefit. Due to that, this kesri dal which is there, it contains a toxin known as BOA. BOA is known as beta oxalyl amino alanine. ठीक है, this beta oxalyl amino alanine is going to cause an adulteration disease in the patient, and that adulteration disease in the patient will be called as lathyrism. Now that lathyrism is of 2 types. Either it is neurolathyrism or osteolathyrism. Osteolathyrism is seen in animals. Neurolathyrism is seen in humans only. ठीक है, more commonly we see neurolathyrism, जहाँ पे the patient will develop paralysis. The patient develops paralysis, therefore the patient is not able to walk, and that is the reason why he has to take a stick with him to walk. That is the reason. ठीक है, so it is a case of neurolathyrism. हमारे patient में paralysis हो गया है, therefore he is not able to walk. ठीक है, तो which toxin is responsible now? It is BOA, beta oxalyl amino alanine, which is responsible for lathyrism, which has been seen in the patient. ठीक है, जल्दी से lathyrism का toxin पता है हमें, it is BOA. And what is the adulterant used? Kesri dal is the adulterant, which is mixed with arhar or tul dal. Epidemic dropsy, what is the adulterant, बच्चों? Epidemic dropsy, the toxin which is used is known as sanguinarine, and this toxin is present in the adulterant, that is that sanguinarine toxin is present in the Argemon mexicana seeds or Argemon mexicana oil. So these Argemon mexicana seeds can be mixed with mustard seeds, or this Argemon mexicana oil can be mixed with the normal mustard oil. So जब सरसों का तेल खाओगे ऐसा वाला which is adulterated, you might develop epidemic dropsy usually. Okay. Next is endemic ascites. The toxin responsible over here is known as pyrrolizidine alkaloids. Okay? So the toxin responsible for endemic ascites is known as pyrrolizidine alkaloids. And it is present in which plant? It is present in a plant known as crotalaria plant. So that crotalaria plant which is there, it is used for food preparation in the central parts of India, like the states of Madhya Pradesh and Chhattisgarh. That is the reason this endemic ascites can be seen in those states commonly. Next is ergotism. If I talk about ergotism, definitely it is due to which toxin? Name itself tells. It is due to the ergot toxins itself. And these ergot toxins are derived from which fungus? Very good. These ergot toxins are derived from a fungus known as Claviceps purpura. Okay? For example, you have stored your wheat or you have stored your bajra for a longer duration of time, और उसपे तुमने ध्यान ही नहीं दिया. So it got infected with a fungus known as Claviceps purpura, जिसकी वजह से purple color की seeds मिल गई है तुम्हें उसमें. That purple color seeds are nothing but these ergot toxin itself. So therefore, for clean, you have to clean that. And cleaning के लिए कितना % salt solution use करते हो? This was another question. 20% salt solution is used for cleaning the grains which are infected with the or infested with the ergot toxin or Claviceps purpura fungus. This has been a PYQ. Next is aflatoxicosis. बच्चे, aflatoxicosis, the obvious नाम से ही है सब कुछ. The toxin responsible is aflatoxin, and it is derived from which fungus? Aspergillus flavus. Okay, so Aspergillus flavus is responsible for aflatoxin, and that causes aflatoxicosis. Aflatoxicosis is seen commonly in which workers? It is commonly seen in groundnut industry workers. They are exposed constantly, and therefore the patient develops which cancer? Hepatocellular carcinoma, that is your liver cancer. Okay, so these are the important things. Now, to apne India mein definitely to assess the food safety standards, we have a authority known as FSSAI, that is Food Safety and Standards Authority of India. This has set particular standards for food safety in India. If these standards are not met, then the restaurants or any food chain is not going to get certificate from FSSAI, and rather they have to be closed. Next is this. This is the logo of AgMark. Bache, AgMark is the standard authority for the agricultural products. ठीक है, so AgMark ना, AG for agricultural products. तो जो भी agricultural products export होते हैं या बनते हैं इंडिया में, they have to set the certain limits or standards which are set by AgMark. AgMark का logo है, मतलब those standards are met. Next is ISI. ISI was Indian System International. That was the standard authority for the industrial products which were produced in India. But now you might be seeing that ISI mark has been replaced now usually. Okay? Now there is a single authority which takes care of all the industrial products, gold products, everything. It is BIS. What is BIS? Bureau of Indian Standards usually. And this has been the logo in August 2020, which was the question. Okay? So certain times these kind of questions will come and you'll not be aware, and that's fine. That's fine. These questions are not going to decide your destiny. That's the important thing you have to be aware of. Question number 16. This question repeated thrice in the examination until now from August 2020. Sustainable Development Goals. Matlab not the exact question, but SDGs. Okay, thrice it has been asked and different questions were asked. According to the SDG, that is Sustainable Development Goal 3, which is ensure healthy life and promote well-being for all at all ages. Target 3.1 is to reduce the maternal mortality ratio by 2030 to less than. This was the recent question. Like I had in my TND earlier also, and this was the exact question which was asked in July 30th examination as well. Now, important is you have to remember that the Sustainable Development Goals are given by whom? United Nations. United Nations ka kaun sa friend? This was the question. It is given by क्योंकि UN 3 ऑप्शंस में था फिर. Okay, it is given by UNDP, United Nations Development Project. It comes under United Nations Development Project, which sets this sustainable development goals, which are to be achieved by all the countries and within a specific timeline. जरूरी नहीं कि abide ही करना है, but yeah, most of the countries will definitely make their policies or make their programs according to the sustainable development goals, which are set by United Nations Development Project. This was the question first of all. Important is, कितने सस्टेनेबल डेवलपमेंट गोल्स है अभी? वी हैव 17 सस्टेनेबल डेवलपमेंट गोल्स नाउ एंड वी हैव टू अचीव देम बाय अ स्पैन बाय टाइम ऑफ, previously it was 2030, now it has been reduced to 2025. Now we have to achieve our sustainable development goals by the year 2025. ठीक है? So no issues with this. Next important बच्चों, definitely 17 है, उसमें से the most important is the goal number 3, because the goal number 3 is good health and well-being for all. That is the only health related goal. ठीक है? और उसके अंदर there are various targets. So the target number 3.1 which is there, it says to reduce the maternal mortality to less than 70 per 1 lakh live births. I hope all of you are quite aware maternal mortality is described as per 1 lakh live births. So it is to decrease the maternal mortality of every country to less than 70 maternal deaths per 1 lakh live birth. 3.2 is to end the preventable newborn and child deaths usually. That means to decrease the infant mortality rate. 3.3 is to end the epidemics of, we have to end the epidemics of HIV, TB, malaria. Okay, so these are the most important ones you have to remember. बहुत सारे और diseases आते हैं इसमें. Next important is 3.4, you have to reduce the mortality from, see 3.3 was for communicable diseases, okay, whereas 3.4 which is there, it is to reduce the mortality from the non-communicable diseases like diabetes mellitus, Alzheimer's disease, cardiovascular diseases, all of that. ठीक है? So at least, and 3.5 is for strengthen the prevention and treatment of substance abuse. तो इतने याद रख लो कम से कम. These are the important ones. 3.1 for maternal mortality, 3.2 for infant mortality, 3.3 for ending epidemics of communicable diseases, 3.4 for decreasing deaths due to non-communicable diseases, and 3.5 for substance abuse. तो यहाँ पे we have to decrease it to less than 70 per 1 lakh live births. याद रखना बच्चों, according to the National Health Mission of India, which was launched in the year 2013, our target was, there were 3 targets. First was to decrease the maternal mortality ratio to less than 100 per 1 lakh live births. ठीक है? So our, क्योंकि अपना मैटरनल मोर्टेलिटी रेशियो तब था 133, देन इट केम डाउन स्लाइटली एंड नाउ इट इज 97 per 1 lakh live births. So we have achieved the target already. Okay, it was a target till 2020. Nevertheless, we have achieved it over time. Next important is to decrease the IMR. कितना? To less than 25 per 1000 live births. This we are not able to achieve still. We are on the verge because we are at 28 infant deaths per 1000 live births. So we have to achieve the target of less than 25 per 1000 live births. And third was to achieve a TFR, that is total fertility rate, of less than 2.1. We have achieved this target according to the recent NFHS 5 data, because now the total fertility rate of India is 2.0. Okay, now we have achieved the target already. It is less than 2.1. Previously it was 2.2. Question number 7. Many young adults and children are admitted in the emergency department with complaints of exacerbation of asthma on May 2nd. No history of any chronic bronchitis. The following pollutant is the most common cause for this condition. What is the cause? So here definitely you have to remember, if the patients are suffering from exacerbation of asthma, there are multiple air pollutants which can cause it, but the most important pollutant which is responsible is ozone. It is not the layer which is present in the stratosphere. It is another ozone gas, which is a toxic and harmful greenhouse gas which is present in the atmosphere. No issues with this, anybody? But if they ask you, previous year question, the most important air pollutant, most common air pollutant, or the most common chemical air pollutant? Answer is same, sulfur dioxide it is. No issues with this. Then another question was, soiling index is used for air pollution, land pollution, water pollution. So that has to be remembered. Soiling index is not used for soil pollution, which was an option in the previous year question. It is used for air pollution. SPM, suspended particulate matter, is used for air pollution itself. AQI, air quality index, is used for air pollution itself. Okay? No issues with this. So please remember this. And which is the best biological indicator of air pollution? Very good. So the best biological indicator, but lichens. The best biological indicator of air pollution is nothing else but lichens. Okay. Next important is question number 18. A person was diagnosed with beriberi with features of edema, pleural effusion causing respiratory distress. Thiamine deficiency results in decreased energy production because TPP or thiamine pyrophosphate is. First of all, beriberi which is there, bacho, it is due to deficiency of which vitamin? It is due to deficiency of vitamin B1, which is known as thiamine. Beriberi can be of two types. Either it can be a wet beriberi or a dry beriberi. Here it is a case of anybody. Wet beriberi, because the patient has developed edema and other features of congestive heart failure like pleural effusion. So if the patient has cardiovascular features, then it is a wet beriberi. If the patient has neurological features, then it is a case of dry beriberi. Okay, if only neurological or CNS related features are there, that is the case of dry beriberi. Both are vitamin B1 or thiamine deficiency in a normal individual. The active form of thiamine is known as TPP, that is thiamine pyrophosphate. Now, what is the reason the patient is having decreased energy production? Very good. Important is, we know that water soluble vitamins like your vitamin B complex and vitamin C, they have an important role, that is coenzyme. They will help the main enzyme so that the reaction can proceed or the reaction can occur. So they act as a cofactor or a coenzyme, we can say, for pyruvate and the alpha ketoglutarate dehydrogenase enzymes. And these pyruvate dehydrogenase enzyme is an enzyme of link reaction, and alpha ketoglutarate enzyme is an enzyme of TCA cycle or the Krebs cycle. Both of these are responsible for production of, सबसे पहले क्या होता है, glucose breakdown, that is glycogen into TCA cycle, and all of these processes together are going to give us ATPs. So therefore ATP production is done by these. But if these enzymes are not working, the pyruvate dehydrogenase of link reaction or the alpha ketoglutarate of TCA cycle, why? Because their coenzymes are deficient. So will these reactions occur? No. So if these reactions will not occur, what will happen to the ATP or energy production? It will decrease. That is the reason why the patient is having a decreased energy production. Important is, bachcho, due to interference in transketolysis activity, yes, it will cause interference in transketolysis activity. Rather, I will say, अगर तुम्हें ये पता लगाना है कि पेशेंट में विटामिन B1 या थायमिन की डेफिशिएंसी है, which enzyme activity you have to check for, then the best is RBC transketolase activity, which has to be checked. This is a previous year question. Vitamin B1 deficiency can be assessed with the activity of RBC transketolase enzyme. अगर RBC transketolase enzyme की activity कम है, that means vitamin B1 कम है patient में और there is deficiency. Why? Because this transketolase enzyme requires vitamin B1 as the coenzyme. तो अगर vitamin B1 नहीं होगा तो transketolase काम करेगी क्या? नहीं करेगी. Therefore its activity will go down. But problem is, transketolase is an enzyme of which pathway? HMP, that is hexose monophosphate shunt. And how many ATPs are produced by HMP? 0 ATPs. Okay, so if HMP pathway band bhi ho jata hai, will there be any decrease in energy production? No. So that is the reason option B cannot be the answer. Okay, baki to there is interference with energy production from amino acid. Transamination reactions are required for that, and vitamin B6 is the coenzyme, not vitamin B1 over there. Okay, interferes with alcohol metabolism. It does interfere with alcohol metabolism, but the problem is it will not cause decreased energy production. Okay, vitamin B1 deficiency in a chronic alcoholic is going to cause, yes, vitamin B1 deficiency in a chronic alcoholic is definitely going to cause a condition known as Wernicke-Korsakoff syndrome. That is Wernicke's encephalopathy plus Korsakoff psychosis. Wernicke's encephalopathy is characterized by the classical triad of GOA, global confusion, ophthalmoplegia, and ataxia. Whereas Korsakoff psychosis is characterized by loss of memory, that is dementia. And second important, confabulation, which is filling up the memory gap by making false stories. That was a previous year question of psychiatry. Question number 19, बच्चों, it states 20 के बाद break ले लो एक. A study is undertaken to determine whether drinking more than 10 cups of coffee a day is associated with hypertension or not. The blood pressure readings were taken of persons. The blood pressure readings were taken of persons who drink more than 8 cups of coffee and the persons who drink no coffee. The results are as follows. Which of the following statistical tests will be used for the above study? बच्चों ये बताओ, what is being compared over here? Blood pressure readings are getting compared over here. In how many groups? 2 groups. One group is the one which are drinking coffee. Other one is the one which is not drinking coffee. If I talk about the statistical test, for those who have not understood, try to understand it once and for all in the easiest manner possible. Let's try to discuss it. Statistical tests बच्चों are of two types. Don't be afraid of biostats. Easy चीजें याद रखनी होती है बस. Nobody is asking you calculation. They are not seen from 2019. एक calculation नहीं आया एक बार. ठीक है? So don't be worried about that. ये formula वो formula कोई नहीं याद रखना. ठीक है? More important is these things. Statistical test can be of two types. One is called as parametric test. Second is called as non-parametric test. In parametric test, we will compare quantitative or qualitative data. We have to compare a quantitative data. We will compare a quantitative data. Whereas in non-parametric test, we will compare a qualitative data. We will compare a qualitative data. What do I mean by this? In parametric test, I will compare a given value or I will compare a mean or an average value. Okay? I will compare a given value particularly or a mean or an average value. But in a non-parametric test, I am going to compare either percentage or fraction. I am going to compare either percentage or fraction. Now let's talk about the first example. Here, sorry, I am measuring blood pressure of all my patients in a ward. For example, this is my ward A and I am measuring blood pressure of all my patients over here. Okay, I have measured their blood pressure and the average blood pressure or their mean blood pressure is 140/90. After that, I give them an antihypertensive drug. Drug देने के बाद, now again I measure their blood pressures and I take a mean or an average value. That is 120/80. Now I'm comparing both the blood pressure, the average or the mean blood pressure I'm comparing. Okay? If I'm comparing an average or a mean value, it is a parametric or a non-parametric test. I am comparing mean blood pressure. So it is a parametric test because I am comparing a quantitative data. ठीक है? तो ये तो clear है? As I am comparing, sorry, blood pressure or the mean blood pressure. So it will be called as a parametric test. Now I am comparing this blood pressure in how many groups? In a single group. एक ही ward है ना मेरे पास. I am just comparing their blood pressure values before giving the drug and after giving the drug. So group कितना है? एक ही है, same group. Just before giving the drug and after giving the drug. So if I compare the value or a mean or an average value in a single group, bache, then it is an example of a paired student t-test. That is an example of paired student t-test. Next is, now I have two wards, ward A and दूसरा वाला ward B. I am comparing, I am measuring blood pressures of all of you. I am measuring blood pressures of all of them. I have done the mean value of this ward A. It is 140/90. Ward B ka 120/80. I am comparing mean blood pressure value of ward A with ward B. Now I am comparing the mean or an average value. So it is a parametric or a non-parametric test? Parametric, because I am comparing mean value. I am comparing mean value this time in how many groups? 2 groups. If I compare the mean value in 2 groups, bacho, then it is an example of a unpaired student t-test. Then it is an example of a unpaired student t-test. Third example is, now I am having 3 wards, ward A, ward B and ward C. I am saying the average value of my ward A patient, average blood pressure value of my ward A patient is 140/90 Average blood pressure value of my ward B patient is 120/80, and average blood pressure value of my ward C patients is around 100/70. I'm comparing what? Average or the mean value. As I compare average or mean value, this is parametric or non-parametric test? Parametric again, but this time I'm comparing it in how many groups? 3 groups. So if I compare a mean or an average value in 3 or more than 3 groups, then it has to be an example of a NOVA test. 3 या 3 से ज़्यादा कितने भी हो, it is a NOVA test. Next, now I am saying that I have a single ward, ward A. Now, out of this, 40% people or 40% individuals are hypertensive. I have measured the blood pressure. Now I am saying 40% people are hypertensive. Then I give an antihypertensive drug, and now only 20% people are hypertensive. Now, what am I comparing? Percentage. So if I compare percentage and fraction, it is a parametric or a non-parametric test? Non-parametric test. I'm comparing this percentage in how many groups? One group. Just before giving a drug and after giving a drug. मैं बोल रहा हूँ ड्रग देने से पहले 40% लोग hypertensive थे, ड्रग देने के बाद 20% लोग hypertensive है. So I'm comparing in a single group. If I compare percentage or fraction in a single group, that is an example of a sign test. Okay. If I compare percentage or fraction, second example is, if I say I have ward A and ward B. Ward A में there are 40% hypertensive and ward B में there are 30% hypertensive. What I'm comparing? Percentage. So it is an example of non-parametric test. In how many groups I'm comparing it? 2 groups. So if I compare percentage or fraction in 2 or more than 2 groups, then it is an example of a chi-square test. Got it? This is the only way you have to remember it. That's it. ठीक है, चलो, going back to our question बच्चे, as we are comparing blood pressure readings, blood pressure reading बोल रहे हैं वो, ठीक है, percentage बोल रहे हैं क्या? नहीं, blood pressure reading मतलब they are comparing a value. As they are comparing a value, it is a parametric or a non-parametric test? It is a parametric test. They are comparing this value in how many group? One group and second group. That is more than 8 cups of coffee wala group and no coffee wala group. So measuring mean or value in 2 groups. Exam answer is okay. So student unpaired T test or unpaired student T test. That is one and the same thing. Got it? This is how you have to remember. They now question number 20. If decision makers have to do comparative analysis of all the available alternatives over their cost effectiveness to find the best solution of a problem, management technique used is. This is a question which is repeated in your examination. Now, first of all, what is cost benefit analysis? Benefit का मतलब कितना पैसा कमाया तुम लोगों ने, ठीक है? That means, for example, you have launched a healthcare program. Okay, National TB Elimination Program हमने launch किया. Now, due to the National TB Elimination Program, definitely the number of TB cases are going to reduce. And अगर number of TB cases reduce हुए तो हमारा जो खर्चा हो रहा था, the amount of money that we were spending on the treatment that we used to use for TB, that is ATT, free चलती है ना वो सब government के पैसों से. So definitely that cost will come down. That means we have saved some amount of money. So definitely if we evaluate, और हम दूसरे साल क्या करेंगे कि ठीक है हमने नेशनल टीबी एलिमिनेशन प्रोग्राम लॉन्च किया, हमें वो देखना है कि वो कितना असरदार रहा, वो कितना अच्छा रहा. So now we will see how much amount of money we have saved at the end. That is what is an example of cost benefit analysis. That means evaluation of a health program or evaluation of the output of a health program in terms of the money saved, in terms of the money saved. That is what is called as cost benefit analysis. Second is cost effectiveness analysis. Again, we have launched the National TB Elimination Program this year. And due to that, definitely a lot of people did not die of TB. That means many lives were saved. So the next year when we analyze the results, we are evaluating the output of this healthcare program in terms of the results achieved, in terms of the lives saved. Therefore, it is an example of cost effectiveness analysis. कितना असरदार, कितना effective ये healthcare program रहा, इसकी वजह से कितनी जानें बच पाई. That is what is cost effectiveness analysis. Next is system analysis. What is system analysis? For example, मुझे National TB Elimination Program launch करना है इंडिया में. I have 3 options. I am asking my subordinates कि भाई please tell me please tell me options. So definitely they have given me 3 options कि sir यही program 3 अलग अलग तरीकों से launch किया जा सकता है. The first way is costing me, for example, 1,000 crores. The next way it is costing me around 900 crores, and the third way is costing me around 800 crores. So now I will compare all these 3. Okay, if I'm comparing, definitely the cost effectiveness, if I'm comparing the cost effective alternatives with each other, and then I'm choosing the best one out of it, that is what is an example of सिस्टम एनालिसिस. मतलब मैं तीनों को कंपेयर करूंगा, मैं ये देखूंगा कि कितना पैसा बच रहा है, बट कितना इफेक्टिव है ये, and definitely according to that I'll choose the way which with which I'll go forward for launching this healthcare program. That is what is an example of system analysis. Comparison of 2 or more than 2 cost effective alternatives before launching a health program to choose the best one. And last is network analysis. It is done by 2 methods. One is PERT, second is CPM. Okay, so let's important cost benefit analysis. It is evaluation of output of health program. HP is health program. Okay, evaluation of output of health program in terms of money. Second, cost effectiveness analysis is evaluation of output of health program in terms of lives saved, or we can say in terms of results achieved. In terms of results achieved or in terms of lives saved. System analysis is comparison of 2 or more than 2. Okay, 2 or more than 2 cost effective alternatives with one another. कौन सा फायदे में रहेंगे, ठीक है. Comparison of 2 or more than 2 cost effective alternatives before launching a health program. Network analysis is of 2 types. One is called as PERT, that is program evaluation and review technique. Okay, and second is called as CPM, that is the critical path method, which is the longest path which we will take to achieve a healthcare program. Answer the question now, bacho. We are doing comparative analysis of all available alternatives over their cost effectiveness. That means we are comparing the cost effective alternatives with one another to find the best solution for a problem in the healthcare program. So answer to this question will be system analysis. Next, agar wo bolte hai that we are recording the activity. For example, we are recording, this is also a common question, 30th July had this question. We are recording the activity of doctors and nurses. Okay, we are recording the activity of doctors and nurses for the time that they spend. Okay, for the time that they spend on patient care. For the time that they spend on patient care, definitely. Then this is an example of work sampling. This is a recent question you have to remember. That is, याद रखो, किसी भी एक पर्टिकुलर प्रोफेशन को अगर देख के उनका ऑब्जर्वेशन करके तुम ये एनालाइज कर रहे हो that what is the kind of activity they are doing, how much time they are giving to their work, what are they doing at their workplace. इसका systematic observation अगर करोगे, that is what is called as work sampling. Systematic observation, recording of the activities done by a particular professional. Does not necessarily mean health professionals, any other professionals. That is an example of work sampling. But तुम्हारे question में usually doctors and nurses का ही आएगा example. ठीक है? So that is a work sampling. No issues with this, anybody? Take a break, then we'll join back again.